Welcome. I'm here with Tina Calise, who's a physical therapist working in the cardiopulmonary ICU unit at Rhode Island Hospital. Tina, tell us how your role as a physical therapist has evolved and changed through this COVID pandemic.
Well, first of all, thank you for asking me to be here. I would have to say that working in a hospital is incredibly stressful as an acute care and especially as an ICU physical therapist. And the amount of stress that has come upon us now with COVID is phenomenal. And the one thing that I think has changed over the past month is number one, the PPE. So the protective gear that we have to put on, the time it takes for donning and doffing that protective gear, and being ever so careful to do it properly and to not make mistakes, because mistakes could let bad things happen. So that's the biggest change. As far as operationally for the hospital, one of the roles of the acute care physical therapist is to get patients out of the hospital as quickly as possible to their home so that we can make bed capacity for the hospital. So that was at the beginning part of the pandemic. That's what we spent most of our time doing, was getting patients home and getting patients to acute rehab or subacute, which was less desirable because of the COVID outbreaks in those facilities. So trying to get patients home. And that's what acute care physical therapists are best at, is decreasing length of stay and getting patients to their appropriate destinations. The other huge change is there are no visitors in the hospital. There's no families with patients. So it's very difficult for patients to be alone, and difficult as a physical therapist in the ICU for a patient who cannot communicate to get information about their home life, who they live with, how their house is set up. So there's a lot of telephone conversations happening with family members and caregivers at home to get patients safely home. So there's a lot of patients who do not live in safe situations, and that's been harder to discern. And a lot more time has been spent on the phone with patients' families and caregivers. There was a COVID physical therapy team established, and a lot of the hospitals in New York have done this as well. And with guidance through the APTA, our hospital has, Rhode Island Hospital has created a COVID PT team. And what that has established is that there's a few physical therapists who are up to date on latest guidelines, latest operational ideas and procedures that should be done. And as the COVID number of patients ramps up at Rhode Island Hospital, we will add more people, more physical therapists to the team as needed. But they are the ones who will help delegate the patient care of the COVID patients. So I would say that's the latest as far as like evolving changes that have happened over the past month as the biggest ones.
Wow. How about PPE equipment? PPE, do you have enough and the supplies where they need to be?
So the governor, actually I watched the governor today, and she made mention that we have PPE, but it's not at the level that she would like it to be at. That being said, we are reusing our PPE, and we are decontaminating it through a process. N95 masks can be reprocessed. We're hopeful that over the next couple of weeks they'll be able to obtain more N95 masks, so we will not have to be reusing them. Face shields and gowns as well. So we have a sufficient, but it could be better.
As far as where the physical therapists are coming, if you do need to deploy or have extra physical therapists in that COVID team, are there enough in the hospital, or are you seeing opportunities or needs to reach out further into the community, or is that unknown at this stage?
For right now, our staff, our inpatient acute physical therapy staff, is able to cover the patient load as of right now. We do have per diem therapists lined up if the surge gets to the point where we need more physical therapists. And we also have outpatient therapists who are being trained, and inpatient rehab acute rehab physical therapists who are being trained also to be acute care. There's a lot of cross training going on right now in the hospital, not just with physical therapists, but with nurses as well. Nurses are learning how to utilize ventilators and learning how to manage A-lines and ICU medications and those sorts of things. So there's a lot of cross training going on now. I would say that the biggest challenge right now in the physical therapy world in the ICU with COVID patients is deciding, because it goes along with the PPE conversation, it's deciding when it's appropriate to go into the room, when is it appropriate to utilize PPE, when is it appropriate to be the clinician that needs to be in the room. So if the nurse cannot mobilize the patient, if the patient is so weak that they can't stand, then obviously it's important for a physical therapist to go in the room. But as each new person enters the room, we're consuming more PPE. So that's a very thoughtful decision that has to happen. There's a lot of communication with the team. Although we do that regularly, there's even more communication with the teams to decide when we go in and when we can have the best effect and advantage to that patient. We also, every time someone goes in the room, we are then a vector of transmission for the virus itself. So it's a careful and thoughtful decision each time we enter.
Well, Tina, it is amazing to hear the experience that you're going through. How are you managing your own stress levels when you get home at the end of the day?
So the support from the community and from our families, I know I can speak personally from my family, has been tremendous. And running, I run. So running, yoga, meditation, and prayer. So that's, I think, my personal remedy for managing stress. And it's humbling to realize, I've always known that Rhode Island Hospital has provided just exquisite care, and they have phenomenal professionals that work there. But I have realized that I work with tremendously brilliant and brave nurses, doctors, PAs, nurse practitioners, and right down to the housekeeping staff and the supply chain folks. I mean, we are all in this together. We are all helping each other out. Physical therapists are beginning to take on non-traditional roles, helping with respiratory. So a lot of outpatient therapists who are not being utilized now are being utilized in other ways, like to work with the respiratory therapists to help them because they are so busy. So it's just incredible to see the teamwork despite the tremendous stress that everyone's under. So.
Well, Tina, thank you so much for your time. I certainly admire you and all the team at Rhode Island Hospital and all the other clinicians working in the front lines of the COVID pandemic. And we are thinking of you and giving you all the support for those of us in the outpatient world. So thank you very much.
Thank you. Pass it along. Tell everyone to stay home for us.
Absolutely.
Surge down.